Welcome to Modern Musings, conversations with the maiden, mother, and crone, where we look at ourselves and the world through the lens of the 21st century. Hi, and welcome back to Modern Musings. I am your hostess, Cindy Murray, and I am here with my co-conspirators, Kristen Blakely and Amber Jones.
Hello.
And we are here with another episode of my review of Anatomy of an Epidemic. This is part 3. So if you're just joining us, you can probably get a lot out of this episode, even just starting now. But we are welcome to go back wherever you find podcasts and find our previous 2 episodes, and we will link them in our Heard It on the Podcast blog post on our website. So
They're pretty interesting, so go find them.
Yeah, I think they are. So I just kind of want to pick up where we left off. As I mentioned, in the first episode, we talked about Robert Whitaker wrote this book to kind of help uncover what he says is an epidemic of mental illness in the United States that, in his theory, has begun since the introduction of psychotropic medications for mental illness. And the first episode kind of talked about the some case studies and some different things. And our last episode, we talked about how the American Medical Association, the National Institute for Mental Health, and other agencies came into power, and how the pharmaceutical industry kind of started. And now I want to pick up where we left off. We ran out of time, and I didn't get to finish talking about the beginnings of the American Psychiatric Association. So I want to talk about this is something that Robert Whitaker kicks off in this chapter of the book, talking about a conference of the American Psychiatric Association. He went to this conference. This is in 2008, and it's a conference for the psychiatric industry. And he talked about it's basically a medical convention and a pharmaceutical trade show, and there's all kinds of training going on and things like that, right? And he wanted to note, he noted that like some of the things are, and we've talked about this in previous episodes too, about how the pharmaceutical industry woos doctors.
Okay, I was like, I feel like we talked about this.
We may have a little bit, but he was at this conference, and there's like these games that they play, and they give away things.
All the free pens.
Not even just free pens. They're talking about bigger things like like thumb drives and vacations and just all kinds of things.
Yeah, my mom used to go to those when she worked for Dr. Carry-On, and she got all the free things.
Yeah, and what they're trying to do is to convince these doctors to prescribe their products instead of somebody else's products. And they also have all kind. It's just like all these talks and whatever. They'll have a lecture, but the lectures are often funded by the pharmaceutical industry. They're not, even if there's like a psychiatrist who's giving a lecture about his research, he's usually funded by somebody from the pharmaceutical industry. And so they're really trying to almost blackmail the doctors into coerce. Yeah. And so and they're all tied to the drug companies. So all of the experts are either a consultant for a drug company, they're on advisory for boards, they get paid speaker fees to go do these talks, they get given research grants, all kinds of things like that. And they've also started using different well, not started, but in the long term have used celebrity patients as marketing tools. So one of the things he talks about is Patty Duke. She was a advocate for bipolar disorder, and she was sponsored by AstraZeneca. And her story emphasized the fact that she had all this suffering before she was diagnosed with bipolar disorder, and that she got salvation through treatment. And then, by contrast, any kind of research that challenges those medication narratives, and keep in mind, this is a psychiatric convention, not a pharmaceutical convention. Mm-hmm. So you would expect some non-medication treatments to be talked up, some other kinds of talks. But when they're talking with these big talks with these experts that are paid for by the pharmaceutical companies, they're in big lecture halls, they're in big rooms, they're hosted over dinner, sometimes very lavish dinner with cocktails and all this. And then by contrast, any kind of research that challenges that medication narrative gets put in a tiny little room. They have a shorter time period to give their talk. There's minimal visibility. They don't promote it to the attending population and all those things. So it's like, it's a business. Pharmaceuticals are a business. And the whole idea of going to these conventions and getting more training and stuff is not about getting more training or learning more about the disease. It's about getting paid to do certain things.
Using the disguise of education to
yes,
use that as propaganda to sell their...
Propaganda, that's a really good word for it. I love that word for it. So, like in one of the talks, there was a talk about antidepressants causing manic switches and turning patients who, once they're exposed to them, into a rapid cycler, which is someone who goes from a manic episode to a depressive episode and back and forth quickly. And they had discovered that they felt like the antidepressants were disastrous for bipolar patients. And the people with depression, bipolar, and schizophrenia are actually losing 12 to 20 years of their life expectancy compared to people that are not in the mental health system. And this talk was actually led by some of the top bipolar experts in the country, and their question focused on whether antidepressants worsen the long-term course of bipolar disorder. And it was just like a tiny little room. So another one he had a talk about giving long-term study of schizophrenia outcomes, and he was only given 20 minutes for his talk. So yeah, it's just kind of sad.
Yeah. And when you think about it, like going to one of those conferences and then what are the lasting impacts? Mm-hmm. You know, obviously the stuff that like hypes you up and gets you excited is going to be the things that you remember. And it's hard for those guys who are trying to sell you like counseling versus, you know, how to have like that really meaningful, touching experience that makes you have a lasting impression in 20 minutes where there's not freebies being thrown out to the crowd and like, you know, lights and videos and
yeah. And when they talk about how, you know, a long time before these medications came onto the market, a lot of the psychiatrists were students of Freud. Mm-hmm. And you know, it was all the psychoanalysis thing, and that there was usually some kind of trauma or something like that that cause these behaviors. But once they started coming up with all these medications, then they decided that there must be a medical reason for this, and they kind of dropped the whole idea of Freudian concepts entirely. And I will say, Freud is like any other scientist, you know, throughout time. The earliest scientists aren't exactly right about everything that they taught or that they learned or presented.
It was just the truest that we knew at the time.
It was the truest that they knew at the time, and they gave a hypothesis that someone else then built on. But the fact that they just kind of abandoned that whole idea is kind of crazy. And I've talked to Ashley, my niece, who's been on the podcast with us before. She's a psychology major at Texas Women's University, and she graduated several years ago. And she laughed about Freud, and they've made his research the butt of jokes.
Oh yeah,
of everything in the psychology field. So, it's kind of sad because he really wasn't that far off. There's a lot of truth to what he discovered. Just like there was some truth probably in the medications that were developed, but we'll get on with that too. So anyway, the whole idea is that they've changed all this stuff, and I want to talk about, I didn't really get into that part of it, but that's kind of where the American Psychiatric Association, their whole thing at this particular conference, and I'm sure it happens at every conference they go to, was that they would have a press conference every day of this thing. And the whole idea was to get out the message that psychiatric treatment works and it's effective, and our diseases are, the psychiatric diseases are real diseases, just like cardiovascular disease and cancer and all these things. And that's really kind of what they've brainwashed the public to think, is that these are physical diseases. They started with this idea of a chemical imbalance, and that's what they're trying to promote, because their drugs, as they say, fix that imbalance. So, but if you go back into history, in 1955, there were about 12,750 people who were hospitalized because of bipolar illness. And there was only the disability rate, we're talking in the United States, of 1 in every 13,000 people. Okay? When this book was printed in 2010, according to the National Institute of Mental Health, bipolar illness affected 1 in every 40 adults. So we went to 1 in every 13,000
to 1 in every 40.
1 in every 40.
And that's why everyone,
in 50 years.
Yeah, and that's why everyone says, "Oh, now everyone has ADD." Or,
right,
yeah.
right. And there's a lot of reasons for that. They with each new iteration of the diagnostic manual that we'll talk about a bit later, they expand the diagnostic requirements. So they expand what symptoms would be classified under each illness, and there's a lot of other things there too. But that's like a crazy number, and they, the quick explanation that they give is that, psychiatry has expanded, the drugs, the ability to get help has expanded the number of people who have come in for help, and so we're diagnosing more people. But if you really look at it, studies of first episode bipolar patients at multiple hospitals found that at least a third of bipolar patients had used marijuana or some other illegal drug prior to their first manic or psychotic episode in 2008. And nearly 2/3 of the bipolar patients hospitalized from 2005 and 2006 experienced their first bout of mood instability after they had abused illicit drugs, stimulants, cocaine, marijuana, and hallucinogens. Dutch investigators, where a lot of drugs are actually legal, reported that marijuana use is associated with a 5-fold increase in the risk of a first diagnosis of bipolar disorder, and that 1/3 of new bipolar cases in the Netherlands resulted from it. Now, I think that's a really interesting statistic, and especially when you go back and look at those early those case episodes that we
everyone except the little girl.
The two kids, the
there
little
was
girl
two
and the little
kids,
boy. Yeah. So and I think that every one of the adults had some form. Not only did they have some form of trauma, or some kind of something that happened that triggered their depressive or anxietal attack, but they also had experimented with drugs in there somewhere. And I just thought that was really, really an interesting
Correlating.
figure.
Yes.
Yeah. And I don't know if there's a correlation, but this is what the National Institute of Mental Health found. And they're the ones who are saying, well, it's a chemical imbalance or whatever. It's like, well, maybe the chemical that caused the imbalance was the drugs, but I don't know. So they also, in 1993, the American Psychiatric Association confessed that all antidepressant treatments, I just said that, all antidepressant treatments, including electroconvulsive therapy, may provoke manic or hypomanic episodes.
Even the electroconvulsive therapy.
They reviewed all these records of these patients diagnosed with depression and anxiety between 1997 and 2001 and determined that those treated with antidepressants converted to bipolar disorder at a rate of 7.7% per year. Per year, which is 3 times greater than for those who are not exposed to the drugs. So 20 to 40% of all patients initially diagnosed with unipolar depression eventually converted to bipolar illness. 60% of those with bipolar diagnoses say they had initially fallen ill with major depression and had turned bipolar after exposure to to a depressant, after exposure to an antidepressant. And once a patient has a manic episode, he or she is more likely to have another one even without the antidepressant stimulation. Lithium. I want to talk about lithium. So that is the gold standard bipolar treatment. Basically the magic bullet for bipolar disorder. It's an alkaline metal that has been hanging around on the fringe of medicine for more than 150 years. And during the 1970s, it was touted as a cure for bipolar disorder. And I've known quite a few people who were diagnosed with bipolar disorder, and it is literally like the first drug that they give a lot of them. Do you want to talk about that, Amber?
Oddly enough, I've been on most of the medications prescribed for bipolar disorder, and lithium was not one of them.
Really? That's
Yeah.
interesting. Okay. It's the lightest metal on the scale, right?
Oh.
And it's reported to dissolve uric acid, and it was used as a therapy to break up kidney stones and crystals that
didn't
gathered
put
in the
two and
joints
two
of people
together.
who have gout.
Weird.
What?
That's so weird because uric acid is like
That's
in
what causes-
lotion and stuff too.
What?
Uric acid is in lotion, so
Oh.
I don't know. I was just thinking that, and it's weird that you would ingest a metal.
Right. Well, they use it. I mean,
Every day we ingest metals.
right. Well, yeah, we do. We eat copper
We eat copper.
and zinc. Well, I don't know if zinc
We
is...
eat gold
know we eat
too. Well, I
iron.
mean, I don't
Iron?
like
Iron is a metal.
I
Yeah,
know iron. Yeah.
some like fancy restaurants will put,
Put
gold,
gold on
Flex.
off-
I know
yes,
that's
yes.
so crazy.
It is.
Like I've had gold before. Oddly.
I mean, there's
enough.
all kinds
Yeah.
of metals
Yeah.
in the food that we
Gold
eat.
leaf.
So yeah. But anyway, it was the lithium was a very popular ingredient in tinctures and tonics and everything. And then they found that it didn't actually have any uric acid dissolving properties.
Weird.
Even though, and we've talked about this too, because we talked about how in the last episode about how they didn't have to prove that, these snake oil salesmen would just say, hey, this is our new chemical. This is what it does.
Hey, is
That's
the best.
really
This is
going
the best.
on still.
Right. It does. They
Yeah.
didn't have to prove that it actually
Go
worked.
on
then.
TikTok. Yeah.
Yeah. So,
Gosh.
and then they actually found that it caused cardiovascular problems. But in 1949, an Australian psychiatrist reported that he had treated 10 manic patients with lithium. And what he neglected to mention in his published article, this happens a lot too, was that the treatment killed one of them and made 2 others severely ill. Right?
Oh wow.
So, lithium can actually be toxic even in very small doses. And since no pharmaceutical company could patent lithium, the APA took the lead in getting the FDA to approve it. And only a few placebo control trials of the drug were ever conducted. And in 1985, UK researchers scoured scientific literature and could only find 4 of any merit. And in those studies, lithium produced a good response in, in 75% of the patients, and that they found that 53% of the patients withdrawn relapsed versus 37.5% of the lithium maintained patients. And so that became their evidence that it worked. So 53% of the patients were pulled off and relapsed, so they decided that was good reason to say that they,
Wow.
yeah. And that's the way a lot of this research, if you reading this book, I can't go through all of the studies with you because there's just, study after study after study. And it's just crazy. It boggles my mind. And one of the reasons I've had to draw out the episodes for this book is because it takes me so long to get through the data to distill it down to something I can share with you guys without just reading the whole book. But one of the things that they noticed, various studies found that more than 50% of lithium treated patients would quit taking the drug in fairly short order. And I've heard this a lot too from bipolar people, because they objected to how the drug dulled their minds and slowed their physical movements. And when they did, they relapsed at an astonishing rate, which resulted in bipolar patients who were treated with lithium and then stopped taking it ended up worse than they had ever been if they had never taken the drug. But bipolar patients today aren't just much more symptomatic than in the past. They also don't function very well. Poor outcome and mania was considered a relatively rare occurrence previously. And we talked about this. A lot of times people in the days before this medication, they would get sick. They might have to go into the hospital, but usually they would be discharged because they got better and they went home to lead normal lives. And very few of them were readmitted to the hospital for the same thing. But then the bipolar patients began cycling through emergency rooms. and more frequently, employment rates began to decline. And soon the investigators were reporting that fewer than half of all bipolar patients were employed or otherwise functionally recovered. So in 1995, only 28% of bipolar patients had a good occupational outcome at the end of 5 years. In another study, they discovered that even though 60% had attended college and 30% had graduated, 2/3 of them were unemployed. And they just have a hard time keeping a job, even when they were only mildly symptomatic. So it wasn't the symptoms of their bipolar disorder, it was the effects of the drugs were causing them to not be able to work. They are neuropsychologically scarred. They're impaired in their decision-making skills, their verbal fluency, and their ability to remember things. And the more medications they're on, the more their psychosocial functioning is impaired. So this, we're going to talk about some of those other people that we talked about in previous episodes. So we talked about Doria. She thinks she should have never been diagnosed with bipolar. She went to see a therapist in Denver because she cried too much, right? Mm-hmm. And she had no history of mania, but then during the final week of college, she had trouble sleeping and grew agitated. And soon she had a bipolar diagnosis and a prescription for a drug cocktail that included an antipsychotic. So she was a teenager and she got turned into a mental patient, basically. And she would have continued to be one for the rest of her life if she hadn't weaned herself off the drugs. In 2009, she was aglow with the blush of motherhood. She had recently given birth to a son, and she and her wife were busy raising their children, with Doria planning to shortly resume her postdoctoral research. The memory of her bipolar days was beginning to recede. And then we talked about Monica. She was the one person who, after an initial interview, actually got off SSDI or SSI. She got a full-time position at an organization that focuses on helping people recover from mental illness. And if you look at her medical history, it's easy to see that her return to work was related to a change in her medication. She admits that she got manic within 6 weeks of being put on a dose of desipramine. And after that initial manic episode, she was prescribed a drug cocktail that included an antidepressant, and she spent the next 20 years cycling in and out of hospitals. And she was constantly struggling with depression, manic episodes, and suicidal impulses. They put her on 8 or 9 different antidepressants, and she also went through a series of electroshock treatments. None of it worked, but in 2006, she casually stopped taking the antidepressant, and for the first time, she was only on lithium alone. And suddenly, the suicidal feelings went away, as did the depression and mania. And that symptom relief is what enabled her to go back to work full time. And now she looks back stunned at what she sees. And this is the thing, they talk about the antidepressant causing the manic episodes.
Yeah.
They talk about all these terrible things, and it's if you look on the warning labels on antidepressants, one of the warnings is that it can cause suicidal thoughts. And your logic will tell you, your mental logic will say, well, the drug that's supposed to fix depression shouldn't cause suicidal
so
thoughts.
Depressed that you think about killing yourself.
Right.
Yeah.
So how is it causing that? When I first read those thoughts, I thought, well, the drug companies have to report every symptom that happens when they're doing those studies. They have to report every symptom as a possibility, right? So maybe some of those people were already so depressed that they were suicidal, And since they reported suicidal thoughts, they put that down. That it wasn't really the drug causing the suicidal thoughts. It was just a symptom of the depression. But now when you look at this, the studies here that he's talking about, it makes it sound like the antidepressant is what's causing the suicidal thoughts. And so you think about how many people are on antidepressants who only after they're on the antidepressants start to have suicidal thoughts.
Yeah.
That's scary.
Yeah. Well, and the interesting thing about the suicidal thoughts part of it is that, like, so my anti-anxietal medicine, that's one of the major symptoms of it. It's not just a minor symptom. You may have stomach or diarrhea, right? It's
right.
Like, it's the first symptom that they
right.
list. And it's interesting because I know several other people who also take the medicine, and we've discussed, like, those thoughts and, like, the depression that it also causes. And it's interesting because it's an anti-anxietal medicine. So instead of running around panicking about, oh my gosh, everything's on fire, it's like, oh man, everything's on fire again. Why am I even alive?
Yes.
And that is like almost like a casual ha ha ha, you know, like it's not that big of a deal. But when you think about it, like, if you're thinking that thought like over and over and over again, then it becomes like
that's
an
suicide. It's
ingrained.
suicidal ideation. Just
yes.
saying, why am I alive? Wouldn't it be easier? And not thinking to yourself, I'm going to kill myself.
Yeah, that's like
just thinking. That's a further step.
Yeah.
But thinking, why am I alive? Why do I have to live through this? That is suicide. That's the start of suicidal
ideation.
That's the start
of it, and most people don't even realize that's
right.
what that is.
Yes,
but it's there, you
right.
know. And it's like you kind of look at the bottle, and you're like, what's worse? Feeling so rotten about myself that I don't even like care or even want to exist during this, or thinking everything is on fire when maybe it's not.
Right.
Yeah. It's like,
so, and it's the anti-anxietal doesn't take away the anxiety.
It just changes my perspective on it.
Yes,
exactly.
It flips that script.
Now instead of it being on fire, I just wish I was drowning.
Yeah.
Or, you know,
yeah,
something, you know.
Yeah.
Different.
It's on fire, you know, maybe
I should just burn with it too.
Right, because it's
What's
hopeless.
The point?
We're all going to burn.
Hopelessness.
It's hopelessness.
Yes.
And so it's terrible.
At least with hypervigilance, you can feel like there's hope and that you can do something about it. And
maybe
so it's kind of
because you are hyper, you know, you're thinking about it so much that you're trying to find an answer to get out of that problem. Right.
Yeah.
Right.
It kind of makes you wonder, like, is it worth it? Taking the pill.
I mean, well, and I told you in previous episodes, after reading this book, I had decided that I did not want to be on my antidepressant anymore. And I've been on anti-anxietals. I've been on antidepressants. I've been on benzos. And they started when I was in my 20s. I was prescribed Xanax when I was going through a divorce. And I talked about this in the previous episode that I was going through the divorce. I went to my doctor and told him I couldn't sleep. I was worried. I was anxious and everything. And he prescribed me Xanax. And he didn't ever ask me what's going on in my life. He did, you know, I was going to be a single parent of a 1-year-old or whatever. And he never asked me anything about my childhood. I never got referred for therapy. He just put me on this Xanax. And then I found that it just messed with my everything. So I didn't stay on it very long. And then later when it was probably a bout of postpartum depression that I had after my son was born. I got really depressed and they put me on Paxil. And that one just made me miserable. I didn't feel right on it or anything. And so I didn't stay on that. But again, they didn't ask me what's going on in your life. They didn't ask me about my childhood. They didn't send me to therapy. They just said, oh, and I had another doctor who just said, so it actually started with my gynecologist because I went to that checkup and he was like, oh, you just need hormones. We need to put you on some hormones and it'll straighten you out. And when I wasn't up for doing that, then the other doctor said, well, let's just put you on some Paxil, blah blah blah. And so so I really the last time that I got on an antidepressant, which is the one that I'm on now, it was not due to any kind of depressive event or anything like that. Although I was going through something that caused depression. I was going through breast cancer. I started on a medication that causes intensified hot flashes. So I was had gone through menopause or was going through menopause. I was having these extreme hot flashes, and then they put me on a medication that makes them even worse. And I tried all of the over-the-counter remedies to stop the hot flashes, and my oncologist put me on a very low dose of an antidepressant, Effexor, which supposedly helped with the hot flashes. And I think it did. I really do think it did. But I also noticed within 2 weeks of being on that medication that I felt a little more lighthearted. Mm-hmm. Which, and I knew that I was sort of depressed because, when you know. And, but then I just suddenly was like, oh my goodness, I really was depressed and now I'm not so much anymore. But I did notice still that even on the antidepressant, I would cycle in and out of depression to a mild extent. And then after, like I said, after reading this book, and now I've read it twice because I read it the first time and wanted you guys to be part of it. And then I read it again to annotate it for these recordings. And it just cemented that desire to get off this train of medication because it's a crazy train. It is a crazy train. And so starting at the first of the year, I started, with the help of my oncologist, weaning myself off of the drug. And the hope is that by the end of the year, I will be completely antidepressant free. Nice. And I will tell you that I'm already weaned down to about a half of a dose. And I don't notice any bad side effects so far. So I'm hoping it'll continue to go that way. And I do know that the longer that you're on something, the harder it is to come off of it.
Yeah.
So and that sometimes you can have severe rebounds from it. Mm-hmm. But hopefully that won't be an issue. So anyway, I want to go to there's two more people I want to talk about here really quick before I talk about the epidemic part of this also. So Brandon can identify the precise moment he became bipolar. There was a series of life events that led up to it. He grew up poor without a father at home, and he has painful memories of sexual abuse, physical abuse, and of a horrible car wreck that killed his aunt and another relative. At school, other kids regularly taunted him about a facial birthmark, which so traumatized him that he began wearing a hat pulled low on his head to cover it up. He graduated from high school in 2000, and he went to college part-time and worked nights at UPS. Soon he noticed that he wasn't feeling right, and when he went back home, his family doctor diagnosed him with moderate depression and prescribed an antidepressant. I went manic in 3 days, he said. The doctor explained that since he had had the reaction to the drug, he must be bipolar rather than just depressed. Yeah, so he said that the drug had unmasked the illness, and Brandon thought this was a positive thing, right?
Wow.
This is a non sequitur if I ever heard one. Right. oh, you must be bipolar because you had this reaction to the drug. Just like when they try kids on ADHD on stimulant medication, and it calms them.
Calms them. So, oh yeah, you're.
Oh, you must. They're a normal child wouldn't have that reaction. Blah 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 blah. Right. So he actually got put on a cocktail composed of a mood stabilizer and an antidepressant and an antipsychotic. And over the next 4 years, psychiatrists constantly changed his prescriptions. He took Depakote, Neurontin, Risperidone, Zyprexa, Seroquel, Haldol, Thorazine, lithium, and an endless succession of antidepressants. As time went on, he became a rapid cycler who suffered from mixed states. So that means, he went from happy to sad or manic or whatever. Yeah. And his records also document the development of new psychiatric symptoms, worsening anxiety, panic attacks, obsessive compulsive behaviors, voices, and hallucinations. Oh, wow. He threatened to jump off the top of a parking garage. His ability to concentrate declined so severely that the state took away his driver's license. At 24 years old, he felt like a total failure. And one day, after a fight with his mother, he moved out and stopped taking his meds. He deteriorated badly to the point that he wasn't bathing and wasn't eating. This happens a lot. However, as the weeks turned into months, his bipolar symptoms lessened, and he began to think that it was more like, as he puts it, I'm just effed up, right? So this thought gave him hope because now there was a possibility of change, and he took off traveling around the South thinking that he might as well be homeless. The journey ultimately turned into a transformative experience by the time he returned home. He had sworn off eating meat and drinking alcohol on his way to becoming a health freak who practices yoga. He stayed off psychiatric medication since then. In 2008, he enrolled in college and he became the managing editor of the school newspaper, which won 24 awards. And he personally got 10 such honors for the articles he had written, including first place in a deadline writing competition. One of his short stories won second place in a competition and was published. One of his photos was picked as cover art for a literary journal. A short film he shot was nominated for Best Documentary Award in a local film festival. In May of 2009, his school honored him with its Outstanding Sophomore Award. Even during the season of remarkable accomplishment, he suffered several hypomanic and depressive episodes that left him feeling deeply suicidal. But he knows that he can't go back to the medication because it didn't work for him the first time. So he's dealing with his depressive and manic disorders, but without the medication. Yeah. And he's functioning better than he did while he was on them. Okay. So, now the last person here I have to talk about on this one is Greg. He was a math and science whiz who had troubled relationship with his parents, and he began to slide into a bad state at the start of his senior year without ever having used illegal drugs. Huh. Okay, so this one's a little different than some of them. He said, I was delusional, very paranoid, and full of anxiety. I was convinced that my parents were trying to kill me, and I was hospitalized for 6 weeks. He was told he was schizoaffective with bipolar tendencies, and he was discharged on a cocktail composed of 2 antipsychotics and an antidepressant. But the drugs didn't chase away his paranoid thoughts. And after he was hospitalized the second time, his psychiatrist added a mood stabilizer and a benzodiazepine to the cocktail and told him he would need to give up his scholastic dreams. So they told him he would be on medication.
That's really sad.
It is really sad. It is very sad. They told him he would be on medication for the rest of his life, and that he would probably be a ward of the state, maybe even by the time he was 25 or 30 years old.
Yeah, completely disabled by.
Right.
Yeah, wow.
And they're saying it's the disease is what's going to make him disabled. But like I said, I think it's the medication actually. The next 5 years passed pretty much as the psychiatrist had predicted. And even though he entered college, he was so heavily medicated that he says he was living in a haze most of the time. From 2004 to 2006, he dropped out and mostly stayed in his apartment, smoking marijuana constantly, as it helped him accept the condition he was forced into. His weight went from 255 to nearly 500 pounds.
Oh, wow.
And he finally said he would rather be crazy and have a life than not be crazy and not have a life. I think I agree with that. He went in for a medical checkup thinking this would be the first step into reducing his medication, only to be informed that he needed to stop taking Depakote and Geodon right away because his liver was shutting down.
Oh, wow.
The
Which is probably why he
withdrawal.
gained all that weight.
Pardon?
Probably why he gained all that
Right.
weight too.
The withdrawal caused physical pain, sweats, joint and muscle pain, nausea, and dizziness. And it was so much that he didn't even pay attention to whether his paranoia was coming back. So he was physically miserable. But in very short order, he was off all his psychiatric drugs except for the occasional use of a stimulant, and he had also stopped smoking marijuana. In late 2007, he went back to school, and he was spending 80 hours a week designing and constructing a robot capable of conducting brain surgery inside an MRI. In a few weeks, he would receive an undergraduate degree in mechanical engineering, and since he had entered a master's program while still doing undergraduate work later that summer, he would receive a master's degree in Medtronics, which is a fusion of mechanical and electrical engineering.
Oh man, he's like savant.
Yeah, well, they said he was like super gifted.
Yeah.
But from his senior year of high school or whatever until, a few years before he went back to college, he was like not able to do anything except sit around and smoke marijuana, right?
Wow.
The author that I wanted to note here because the Robert Whitaker said it made him think of John Nash, the Princeton mathematician, whose inspiring story of recovery from schizophrenia and doing so well off of medication was told in the book A Beautiful Mind.
Oh,
so,
yeah.
Yeah. So, it's very, very inspiring. So we're going back and talking about that, in 1955, history tells us that the state of these hospitals were just bulging with raving lunatics. And then researchers discovered this antipsychotic medication, Thorazine, and that drug made it possible for states to close their hospitals and treat psychiatric patients in the community. And that psychiatric researchers discovered anti-anxiety agents and antidepressants and the magic bullet lithium for bipolar disorder, and proved that the other drugs all worked and all these things, So, all these things, and they were telling their patients, these medicines work, and so and then if they were withdrawn from the drugs, then they would have, rebound effects, worse episodes than before. And so it made people say, well, I have to stay on these drugs because I need them. I can't do well without them. So, and I can't remember if I touched on this at the beginning of this episode or not, but they talked about they're talking about these hospitals being full of all the crazy people, and that, and they're saying that the reason that there are not so many of those people in the hospitals now is because we have these great medications and they're taking care of everybody and blah, blah, blah. Right. But there's actually a fact here that they fail to note, and that's in the 1960s, before Thorazine's arrival as a asylum medication. all the discharge of all these chronic schizophrenia patients actually happened because of the enactment of the Medicare and Medicaid legislation in the 1960s.
Oh, because Medicare, Medicaid didn't want to pay for them.
They didn't want to pay for them to be in those hospitals. And so they turned them loose into the public. And it's really not because of Thorazine's arrival or whatever. And so there actually was never any kind of scientific breakthrough that led to the introduction of Thorazine, because we've talked about that too, or any of these other drugs. Instead, scientists that were studying these compounds for use as anesthetics and magic bullets for infection and things like that just stumbled onto several agents that had novel side effects. And rather than fixing any kind of chemical imbalance in the brain, the drugs actually create one. And they worsen the long-term outcomes of people. And so when he talks about an epidemic, he asks this big question: why have we seen such a sharp increase in the number of disabled mentally ill in the United States since the discovery of these medications? And some people believe it's due to an iatrogenic issue, which an iatrogenic is any illness, injury, or adverse effect that is unintentionally caused either by a physician, a surgeon, or a medical treatment.
Okay.
So they think that it's because of the medications that's causing this epidemic. And he talks about how our society is organized in a way that it leads to a great deal of stress. We are under way more stress than our previous generations were. You know, we have a lot more to deal with and a lot more emotional turmoil. Our close-knit neighborhoods. Like when you were a kid, there were closer, or at least when I was a kid, there were closer neighborhoods, and you knew who all your neighbors were. You were friends with them. They looked out for you. They looked out for your children. Your kids all played together. You took care of each other, all that kind of stuff, right? And that doesn't exist anymore. We don't have those kind of neighborhoods, and we don't have that kind of mental and emotional support when things are going on. And we watch way too much TV. We don't get enough exercise. We eat a lot of processed foods that cause problems. Illicit drugs is a huge, it's grown. And, marijuana is legal in a lot of states, and they're already proving that the marijuana can cause some of these issues. So he's talking about all of that stuff. And then he's talking also about when a person goes on to SSI or SSDI. So say they've been on these medications, and for whatever reason, whether it's the drugs or the illness itself or whatever, they go on to SSI or SSDI because they can't support themselves. And what happens is that there is a financial disincentive to return to work. And I've seen this happen firsthand. This happened with my sister who was on SSI. It happened with my niece because they put her on SSI as disabled when she was a child. And then my sister became dependent on that income and prevented her from going off of it because she would lose that income. And so there's this huge disincentive. And unless you can get a job that pays for health insurance, people that are on disability are trapped, and they'll lose that safety net because you can't pay for your medication if you don't have insurance. So, and so it really is a problem. And okay, and so he's talking about how, and we've quoted these studies and these odds many times, that in the decade prior to introduction of Thorazine, about 70% of people suffering a first episode of psychosis got discharged from a hospital within 18 months. And the majority of them never went back to a hospital. So they just went on to live normal lives. They had jobs, they had families, they did whatever they did. And researchers in the post-Thorazine era report similar results for unmedicated patients. So, so if you don't get the medication for the schizophrenia, you're likely to go in the hospital for 18 months and then come back out and go on with your life, right?
Right.
But the standard of care now is that they put you on the medications right away. And only 5% of medicated patients now recover over the long term. And there is an estimated
small amount.
2 million adults disabled by schizophrenia. That's a tiny amount, from 75% to 5%, right? And anxiety used to be viewed as a mild disorder, but today 8% of younger adults on SSI and SSDI rolls, due to a psychiatric ability, have anxiety as their primary diagnosis. 8%.
Wow.
Outcomes for major depression used to be good. In 1955, there were only 38,000 people hospitalized with depression, and the illness could be expected to remit. Major depression is the leading cause of disability in the United States for people aged 15 to 44.
Wow.
Major depression is
Major
the
depression.
leading
It's
cause of disability in the United States.
Not
a physical,
people in wheelchairs or
not a
blind
physical disability.
or, wow.
Depression.
Yeah.
It is said to strike 15 million adults, and 60% are severely impaired, according to Johns Hopkins School of Public Health. As for bipolar disorder, an extremely rare illness has become a common one. And according to the National Institute of Mental Health, nearly 6 million adults suffer from it. 85% used to recover from it and go back to work. Now only about a third of bipolar patients function this well. And over the long term, those bipolar patients ended up nearly as impaired as those with schizophrenia who stay on the neuroleptics. So all of these people that are getting on the drugs and staying on the drugs, their symptoms are worsening over time, over the long term.
To the point where they can't work, and then they have to be on government assistance, which
Yes.
pays for it. Wow.
Yes.
That sounds like a Ponzi scheme to get a government funding.
I know, right? So they talked about all these things, and not just their mental capabilities declining because of the drugs, but it also starts affecting their bodies, their physical bodies too. And that's one of the reasons he calls this an epidemic. And that's one of the reasons these people wind up on SSI, SSDI, right? So usually one of the aspects of fleshing out the nature of a disease involves identifying all of the symptoms that can develop and then following their course over time, right? You know, like that's what you do with COVID or the cold or the flu or chicken pox. You know that chicken pox might eventually cause shingles or whatever, right? With these psychotropic medications, they worsen the target symptoms, but they didn't really talk about the other things that they can cause. And so he devotes a whole chunk of the book to some of these things. This medication can be a form of care that leads to early death. And we mentioned that earlier. The seriously mental ill are now dying 15 to 25 years earlier than normal. And they're dying from things like cardiovascular ailments, respiratory problems, metabolic illness, diabetes, kidney failure, and stuff like that are caused by the medications. And they give those as a warning on the label, you know, that they can cause these things. But everybody's thinking, well, if, you know, the doctors are telling you have to take this, you will never be normal unless you take this.
Right.
And so,
but it's okay because they also make a pill for that.
Yeah, you could take a pill and we'll keep you from getting diabetes, or we'll do this to, you know, they'll give you all these other drugs to keep you from having all these symptoms or whatever. But the thing is that these things just keep piling up and piling up and piling up. And the longer you're on the drugs, the worse it gets. So this patient that he wanted to talk to is Amy. And she has all kinds of medical problems. She has drug-induced swelling of the brain, faltering kidneys, a swollen liver, swollen gallbladder, thyroid problems, gastritis, and cognitive abnormalities. She's very underweight, and she has loose skin because the muscle underneath it is wasting away.
Oh, wow.
Okay. And she's 30, I think she's 30 years old, and she's kind of showing him the flap of skin, and she said, this is what you see when you're looking at heroin users, that's what she looks like. She started taking medication when she was 16 because she contracted Lyme disease and she had a bout of depression. And 12 years later, she was still on antidepressants, and the drug stirred hypomanic episodes and worsened her obsessive compulsive behaviors. In 2007, she decided to gradually wean herself from the drug combo, and it went well at first. But at the time, she was working for the county mental health department as an advocate for the mentally ill. And eventually, someone anonymously informed her bosses that she was going off her medication. And that was against what the agency preached. And it ended with her out of a job and paranoid that someone was stalking her. So somebody reported that she was going off her meds, and she lost her job because of it. She's had a nervous breakdown. She went into a hospital to hide, as she says. And this was the first time she had ever been hospitalized, and she was immediately put on a cocktail that included lithium. And within a few months, her endocrine system began to fail. Her menstrual cycle ceased, her thyroid went haywire, and an EEG revealed that her brain was swollen. Then her kidneys started shutting down, and she had to abruptly stop taking the lithium, and that triggered a manic episode. So they put her on Ativan to counter the mania, but that stirred a horrible rage and left her feeling suicidal. In December 2008, she checked herself into a psych hospital where she was diagnosed with Ativan toxicity. The hospital switched her from Ativan to Klonopin and prescribed Abilify, which triggered a seizure. The doctor then discovered something was wrong with her heart, which appeared to be related to the Klonopin. And so she was put back on Ativan, which was toxic. And then she started having hallucinations. And other drug-related complications ensued. And in February of 2009, she moved to a shelter on the hospital grounds. Her thoughts are now so scattered that a nurse wondered if early Alzheimer's runs in her family.
Oh, wow.
That's how messed up she is. She spent the last 4 months trying to get off the Ativan, but every time she dropped to a lower dose, she suffered fits of rage and something akin to delirium. She was in a constant state of panic, anxiety, and agoraphobia.
Wow.
She can't leave her house. Here's another one. Rachel. She met Robert Whitaker in the spring of 2008, and she came into his office with a cane and a service dog. She wasn't even 40 years old yet, and she's told about a tale starting in 1984. Again, she was 16 years old. She was entering MIT as a child prodigy. And do you notice how many of these people are really, really smart? I think that might be a really big clue right there, too. She was a child prodigy entering MIT as a 16-year-old with an IQ of 173. Wow. And there were predictions that she would one day win a Nobel Prize. To quote, "I arrived on campus with a teddy bear sticking out of my backpack. That's how ill-equipped emotionally I was." You can imagine what happened to her to start with. Her emotional crash at MIT got underway at the end of her sophomore year when she became involved with an older student who was totally psychotic, and she began using illicit drugs: ecstasy, acid, mushrooms, and nitrous oxide. Her sense of self began to crumble, and after a summer of talk therapy that left her more confused than ever, she was hospitalized for psychotic depression. When she was released, she had prescriptions for an antipsychotic, an antidepressant, and a benzodiazepine, Xanax. None of those drugs helped me, she said. They numbed me out, and trying to get off Xanax was a disaster. That's the evilest drug ever. It's so addictive, and all of the symptoms that caused you to go into the hospital in the first place get 1,000 times worse when you try to go off it. That's what she says. She did eventually graduate from MIT and was accepted to an MD, PhD program at the University of Colorado, and she began cycling in and out of hospitals. Her crash at MIT transformed into a case of chronic mental illness. She says, they told me I was hopeless and that I would never get better. She enjoyed a period of stability from 1995 to 2001 when she worked as an assistant house manager at a group home in Boston, but then her brother died suddenly and her psychological problems flared up again. Her psychiatrist took her off Risperdal and switched her to high doses of Geodon and Effexor, and he gave her an injection of another psychiatric medication as well. I had a severe serotoninogenic reaction, a toxin reaction. It caused vasoconstriction in my brain, and this caused brain damage.
Oh, wow.
I ended up in a wheelchair and couldn't think, speak, or walk. Since then, her life has had ups and downs. She does volunteer work with Empower, the Boston peer advocacy group, to provide services to the deaf, but she has also battled ovarian cancer in the past. It is possible that illness was related to the psychiatric medications because it changes your hormones. Yeah. Okay, and then and this is the last one that I'm going to share here, and then and we'll leave it at this, and we'll start back with the next episode later. This one is Scott. In the spring of 2005, Scott received an MBA from Rice, but he broke up with the woman he had intended to marry, and he was hospitalized for depression. And I want to point out every single time, and I've said this, every single one of the instances where they were diagnosed with depression or whatever, it's episodic. It's related to something that happened in their life. The depression doesn't just come out of nowhere. But they're not getting therapy for it. They're just put on the medication immediately
dosed. Yeah.
Right. So he broke up with the woman he intended to marry, and he was hospitalized for depression. This was his second bout of major depression. He had had one the first time 5 years earlier when his parents divorced. Not uncommon. And since his father had suffered from bipolar illness, he was now diagnosed with the disorder. So they didn't just say depression. He went in the hospital because he had something traumatic happen to him.
Probably checked that off in his medical history.
And then they just went, well, he's bipolar too. So they checked it off. So he was put on a cocktail that included Zyprexa. His first few months on a new job went fine, but early in 2006, so we're talking a year later, he was sleeping 12 to 16 hours a day, zonked out by the Zyprexa. He soon needed another pill to get up in the morning, and he began putting on weight. He was 5'10", and he went from 185 pounds to 250. He had a beer belly, and his cheeks looked like he was a chipmunk. By the fall of 2006, we're talking a year and a half later, he was sleeping so much that on weekends he wouldn't get up until the afternoon. So on that Thanksgiving, he called his mother to tell her he was suffering from severe stomach pains. So it hasn't even been 2 years that he's been on these drugs. He's already gained 70 pounds. Yeah. And he's having severe stomach pains. And the next day he was admitted to St. Luke's Episcopal Hospital in Houston, and he was beet red, sweating, and his hands were so swollen that they had trouble getting his ring off. He was burning up, and his lab tests were wacko. They were off the wall, sky high. His triglycerides were off the charts, according to his mother. His pancreas was shutting down.
Pancreatitis.
Zyprexa was known to cause pancreatitis.
Yeah, when you said the The triglycerides.
They kept him on the drug
No way.
until his death on December 7th. 2 weeks.
They just left him on it? That's crazy.
Because the doctors didn't connect the dots.
Wow.
Okay. So that, like I said, that is when I look at this and I look at the people and the problems that they're having, I think medication is not the first answer here. When the medication's not working, they just change it to another medication. And the medications, do you know of any other medication where it's worse than the disease itself?
I mean, any of them that say thoughts of suicide, like I see the commercials all the time on TV for the psoriasis, right?
Right.
I have psoriasis.
Right.
I am very fortunate that I don't have it on my face.
Right.
Or in my hair, like on my scalp.
Right.
Because those, I can't imagine.
And you don't have it in places where it's on your bare skin and people think you have a contagious disease or whatever.
Yes,
yeah.
Mine is on the bottoms of my feet and my elbows, and
right.
I'm very fortunate that no one can see it.
Right.
And I just scratch my elbows all the time, So I see those commercials though, and I'm just like, dry, itchy, flaky skin, or wishing I was unalived.
Right.
Like I can't imagine it. But I could imagine somebody like hating their face so much because it's causing discomfort.
Right.
And psoriasis hurts.
Right.
But
when you're
was
also
it
talking
worth-
about this massive weight gain, okay, so all three of us can relate to the massive weight gain. I'm
Yeah.
not even, now I'm going, well, is my massive weight gain due to some drug I've taken, I mean, I know
Most
it's bad
likely.
habits. What?
yeah.
Most likely.
Probably. And all these things, like heart disease and kidney failure
Yeah.
and, I'm speechless. I don't even know what to say because I'm thinking, they tell you the drugs can cause this, but they do it, like they advertise this shit.
Healthy person jogging on a beach and they're happy.
Yes,
And you
and they're
think,
advertising,
oh,
and
yeah,
they're
they don't have those
advertising it to
problems.
you on TV, like you can just go to the doctor and say, "I want this drug."
Yeah.
And
'Cause I want to jog on the beach
I don't
with
think-
my senior spouse.
Well, and
Yeah.
I don't think they should be advertising it to TV
People on
watchers.
TV, yeah.
Or in magazines. I think that information should only go to the doctors. I think the doctors need to be more forthcoming about the medication and other options besides medication. Because, I've had doctors say, okay, I'm going to give you this drug. I'll even start right here. My doctor suggested I go on Ozempic for my diabetes. And we're not even talking about that class of drugs, right? But this is the perfect example of what they do with these drugs. She said, we'll do this and it'll help control your blood sugar. It does. It absolutely does. But she never once told me the side effects. When I went to the pharmacy to fill this, they give me this 10-page packet of paper that has all these stupid side effects in tiny writing. And they act like you're going to actually read that. Are you actually going to read that? Do you know anybody who actually reads that? No. And they give it to you, and then maybe if it's the first time you've ever gotten this, the pharmacist might come and say, do you have any questions? Well, if you don't know what questions to ask, how are you going to have any questions? My doctor told me I need to take this, so I'm going to take this. And so you come home and you take it, and then lo and behold, 6 months later, one of your friends goes, well, doesn't that cause this and this and this? And I'm like, well, yeah, maybe. I don't know. I mean, seriously, that is the typical patient's reaction to the way these drugs are dispensed and prescribed. And do you do anything different than that? Do you read all of that paperwork?
No, because actually the whole thing of the thoughts of suicide on the Lexapro that I take, that was actually just something that I stumbled across when I was flipping through some papers that I was deciding to shred or not. And I was like, wow, that's really interesting that that's the first thing that they mentioned. And then, you know, my doctor did say it could cause weight gain. And I was like, I mean, I'm already fat. So,
Right. Yeah.
you know, and now that I wonder, like, you know, I got prescribed that medicine in 2018, a few months before I had my surgery.
Right.
That I have been struggling with losing weight. And I'm like, dang, you know? But
Maybe
then
that's
I
why-
was having a conversation with a friend who also was on that medicine. And we were talking about those suicidal thoughts. And
Right.
like, I was like, it's not what everyone thinks. It's not like, oh, there's a gun, I'm going to shoot myself. It's not like that at first.
Yeah.
It's the other things. Like, I wonder if people would be sad if I died.
Yeah.
That kind of stuff.
I
That's the start.
My
of
husband
it.
is dead, and the life that I was going to have can't ever exist ever again.
Yeah. Those kind of
What
thoughts.
reason do I have to keep going?
Yeah.
It's not that I'm sitting here thinking I want to die. I don't. But it's like, I wonder.
Intrusive thought. Yeah.
Yeah, it's just an intrusive thought. And I know I have those. And I've talked to other friends who are on similar medications, and they have, you know, and we've talked about it. I'm not suicidal, but I have had suicidal ideations, you know, that I wonder what. I wonder if anybody would care if I'm gone.
Mm-hmm.
I wonder, you know, what would happen if. Not that I'm going to go driving off the High Five Bridge, you know.
Yeah.
But, you know, you drive over it and you kind of go, well, I see how people could just go, yeah, like sudden thought. And, yeah.
Like, why are we even thinking about that? Like, how did that little poof of cloud thought, like, even
creep into my brain.
come
Yes.
into your brain?
And I do hope, and I want to iterate this, if you have suicidal tendencies, please call and get help. I will add a suicidal hotline information to the end of this episode. And, you know, if you have those thoughts, call someone, talk to someone, get some help. And again, as we've talked about on the previous episodes, if you are taking these medications and you want to stop taking these medications, do not go cold turkey. Go talk to your doctor and make a plan to withdraw safely and slowly. As I have learned, that even I'm on the second lowest dosage of Effexor that you can be on. And it is going to take me a full year with a controlled plan to come off of it without having a setback. So, and that's just a very, very, very small dose. So if you've been on drugs for a long time, I've been on them for almost 10 years now. So if you've been on longer than that, or you're on a stronger dose, or you're on multiple drugs, please do so safely with the care of a physician. And did you have anything to add to that, Amber?
No, definitely don't go cold turkey. I've been there, done that.
Yeah, it's not good. It's not pretty.
Got a T-shirt from it.
Yeah. So please think about these things, and like I said, go read Robert Whitaker's Epidemic of an Epidemic. If you don't want to take my word for what we've talked about here.
Anatomy of an epidemic.
Oh, what did I say? Epidemic.
That too.
Go read Robert Whitaker's Anatomy of an Epidemic. It's a fascinating book. There's a lot of case studies in here. We've barely touched on it. When we come back, we're going to talk about children and how this epidemic is spreading to children, and then eventually into what he considers a way to get out of this epidemic. So hopefully we will get those covered in future episodes. And for now, next week, Amber, what are we talking about?
We are talking about tiny habits. the book by B.J. Fogg, The Small Changes That Change Everything.
Another book.
Yes.
Yes, another book.
I know we love to read. We've talked about that before, and we love to share these ideas with you. So I hope you'll stick with us. These are going to be some really great episodes coming up soon. And have a great week. We'll be back next week with Tiny Habits. Bye. If you or someone you know is in crisis and needs help, please dial 988 to reach the Suicide and Crisis Lifeline. You can dial 988 or text 988, and help is available. You can speak with someone today.